Hi!
Hi, I'm Dr. K.V. Narayanan, speech and swallowing specialist and autism specialist. Today we'll discuss about what is speech therapy and who is a speech therapist. Speech therapist is generally, the people who cannot able to communicate properly, cannot able to transform the information to other people will have the speech difficulties. The speech difficulties range from the small kid to the adult age. There is no person who cannot able to speak properly if there is a normal communication is not there. The thing is now, the children, especially for the children with speech delays, speech problems, delay in speech and language communication disorders, we can see it. Delay in communication transformation, we can see it. So there are children like autism children, we cannot able to speak properly. The same way, cerebral palsy kids, the kids was not able to move the proper coordination of the oromotor structures. In the same way, mentally structured kids, mentally retarded people, the same way, disabled people, these people cannot speak properly. Coming to the next level of the speech is especially stuttering. We call it as a stammering kids, right? So stammering and they cannot speak properly and all. And there are some people with learning disability. They cannot learn properly, they cannot write properly. What we say, they'll write the same way. They say wrong, they'll write in the wrong way only. Coming to the pronunciation problem, there are some kids who cannot pronounce properly. We call it as misarticulation things. In misarticulations, we can see in place of ra, they'll put la sound. In place of tha, they put dha sound. So placement is different. Manner of articulation will be a different conditions we can see it. In the same way, the person with androphonia or puberphonia, in the sense, the girls with a male voice, the boys with a female voice. So these are the problems also will comes under the speech. And the thing is, the patients with the adult patients with the cancer will have the problems. If they have the tongue cancer, they'll remove the cancer, there is a speech problem. If they have the mandibular cancer, there is the mandible removal, laryngeal removal. Depends upon the condition, depends upon the cancer stages. Whatever part that will remove will have effect with the speech. Then next, coming to the brain stroke patient, the adult patients with the brain stroke. Sudden brain stroke, they lost their speech, slurred speech, they can't speak clearly, and because of that, the speech get affected. In the same way, the children, adults, and other people who cannot speak properly will have speech issues. All these things can be carried out, assessment done by the speech therapist, and do a proper planning. What are the things that cannot be speak by the children or adults, that will be planned by a speech therapist and will execute it and will treat the same thing, what are the problems that has the patients. He is the speech therapist. Thank you.